Good afternoon, everybody. Welcome to our first webinar in the Public Service Spring Series. I'm Jamie Machek, the Education Consultant with the Wisconsin Valley Library Service, and I'm glad you're here with us today. This is our first webinar, as I mentioned, in a Spring Public Services series, and today we're going to be talking about from plexiglass to physical distancing, library spaces in 2021, and we have Curt Byler with us, who's the Facilities Manager at Brown County Library. I want to mention right now that Curt is going to be sharing several handouts today, and we will be sharing those on our website. They will be posted probably by the end of today. I just didn't get a chance to post those yet. So when you see those, you will have access. He was very generous. Curt was very generous in sharing those. You will have those. You will also have a copy of his slide deck as well. And of course, this webinar is being recorded. So wanted to get that out of the way. So Curt, please begin whenever you're ready.
Great, thanks, Jamie. Like Jamie said, my name is Curt Byler. I'm Facilities Manager for Brown County Library. Today we'll talk about the Brown County Library story, how we've gotten through the last year, then some planning, document creation, and training, and then the measures we've taken, and then what's going forward, what's coming up. I don't know if any of us know that. And then we can take questions if we have time. So Brown County Library is a consolidated library system with 9 libraries throughout Brown County. We have 6 in the Green Bay area, with Central being the largest, about 93,000 square feet. Our Cress and Wyers-Hilliard branches are in Howard and De Pere. They're both more than 20,000 square feet. Then we have 3 smaller libraries in the area, 2 in Green Bay, 5 and 6,000 square feet, and 1 in Schwabenheim, 8,000 square feet. Then at the edges of the county, we have our 3 rural branches. So our story begins probably where everyone else's did on March 17th when the stay-at-home order came out. But essential workers, we were considered essential workers, so we returned to work although the libraries were closed to the public. So almost immediately we got to planning for the future and what was going to happen and how were we going to get through all of this. And actually, if you see the March 17th, how many cases we had on this graph, well, let me explain the graph. So the light blue color is Brown County cases and the scale is on the left. So that's different. The dark blue are Wisconsin cases and the scale is on the right, but I just wanted to make them similar so you could get an idea of how things were going in the state and in the county. So March 17th with that stay-at-home order, already we are close to the public, and I think Brown County had 17 cases and the state had 940. Looks like Brown County didn't do great over April. I believe we had 1,500 by the end of April, and the county had almost 10,000. But just hard to imagine how scared, at least I was at this point, and who knew what was coming. So then our first move, I guess you could say, was to start contactless pickup. Through the entire time, we kept our digital resources. So we had ebooks and audiobooks and all of our digital resources. We kept we had Wi-Fi and outlets on the exterior of the building. We even changed some outlets out to include USB jacks. And then we still answered the phones and took reference questions and did technology help. So we thought we needed more. We started contactless holds pickup. So that wasn't curbside. We weren't going to walk them out to your car for you. But in the locations where we had sufficient overhangs to protect the materials from the weather, we would set up tables outside. Patrons could then place holds and then call in and schedule a time that they would be picked up. And the librarians would check them out, put them in plastic bags and leave them out on the table during their pickup window. The next critical thing we thought the community needed that we thought was somewhat doable was computer use by appointment. So that was the first time we had people in the building. We had to rearrange the computers to be socially distant, and we would take just computers by appointment. Next, we opened for intentional browsing. So this was a huge step. This is the first time we let people in the building, wandering around, not just seated at a computer station and without an appointment. And then that gets us all the way to 4 days ago, where we increased our intentional browsing capacity. We opened meeting rooms with limited capacity and study rooms, and the bookmobile now makes stops dropping off holds to communities around here. And all of that with no known outbreaks or transmissions. I think we're all really proud of that around here, and we should be. But we planned this to, we wanted to take things really slow with baby steps, carefully and thoughtfully, so that we could step back if necessary. And that did happen once or twice during the process. So then what we started immediately, like I said before, was lots of planning, lots of meeting, document creations, training of staff. There's just so much to prepare for, which I don't think any of us had ever run into before. And this was a huge collaboration. I think every single person in the organization had input into most of these documents. Sarah Sugden, the executive director, and Emily Rogers, the deputy director, played a huge part in a couple of these documents. Basically did all of them, but we all gave input. And the entire administrative team and the managers too at the library, we all really played a huge part. So by no means did I do any large percentage of this. I just did my part. Oops, don't know how that happened. So I think one of the key documents that kind of pulls everything together that we keep going back to and also keep revising as needed due to community conditions is the reopening chapters outline, I'll call it for now. So at a glance, you can see where we are, where we've been, and where we're going. It starts with a prologue, and then it goes through chapters 1 through 7. And we intentionally didn't try to project dates for any of this because we didn't know what was going to happen. And really, we wanted to base the movement from one chapter to the next on community conditions and not on an arbitrary date that we just set out and were shooting for. So most of the time, the dates weren't even put on here until after it was open. Of course, we would have to plan for the event coming up, but we just needed to be nimble in that way. Going hand in hand with that outline is the pandemic reopening playbook. In that, there's a narrative and it has much more detail than the outline. So in that playbook, we start with the prologue. Like I said before, online services, telephone resources, Wi-Fi, and outlets to the exterior, we're still 100%, obviously, but because of the order, we quarantine all of our return materials for 96 hours. Holds were suspended, computer access suspended, the building is closed to the public, and obviously no meeting rooms either. So that brings us to chapter 1, where we added contactless pickup. So still no one entering the building, they would call for their holds, schedule a time window, and then we would check them out and bag them and place them on a table just outside the doors. That initially we started with the locations with good overhangs and weather protection. And then shortly thereafter, we figured out how to do it at other locations by putting them in vestibules or other areas where the public wouldn't really have to enter the building. So chapter 2, we started letting people into the building for computer use by appointment only. We thought that was pretty important. And you'll see the quarantine kind of fluctuates. So it went down to 72, I believe, based on the DPI document that we had all received. We were being extra cautious with a 96-hour, but the DPI document had said 72. So we switched as we needed to. And then chapter 3, again, the quarantine period fluctuates. I believe it started at 72. DPI said it went to 48, and then I believe it switched back to 96. So it was a little bit back and forth. Holds now you can pick up in person, or you can still do the contactless. And then we opened up the building to 25% occupancy based on that DPI document as well. In the, I believe around October or so, during the biggest part of the mess, we did scale back our occupancy to 13%. And then at one point, once staff and everyone were comfortable with the conditions and the occupancy, we went back to 25%. And that gets us to 4 days ago, where we are starting a little bit later. But the quarantine period for return, we're still doing contactless pickup. Some customers want that, and we'll continue to do that for now. Computers are still by appointment, although we have many more set up. The building occupancy is up to 50%. And meeting rooms, where meeting rooms are available, we have them set up for limited occupancy. So another document we have is the Saf Safety Guidelines. This document, the deputy director and I met with every department virtually on a Teams meeting and went through this entire document with all of them. And then all new employees who started the library, we'll meet with them virtually as well, or maybe in person soon, we hope, and go through aspects of this document. Then they sign it and return it to us. So in that document, we have inventories of PPE and other materials necessary at each location. Basic strategies to mitigate the spread. We want to make sure we're going over everything with every single person in the organization. Routine disinfecting measures. So that's what we disinfect, who does it, how long, and the frequency per day. And then the very basics, how to wash hands, how to wear a mask, how to put gloves on and take them off properly. And then more in my area is the disinfecting procedures. This was kind of an evolving list or an evolving process, because at the very beginning, not very many items are on the EPA's N list, which it's a list of certified disinfectants that are proven to be effective against COVID-19. So right away, we had to look at that list and switch to items that were on that list. One of our favorites is this Rejuvenate disinfecting wipe. I don't know if everyone knows this, but every disinfectant has a dwell time to kill a certain pathogen. And that means whatever you're wiping down with it must stay wet with that product for that amount of time. So the dwell time on these wipes is only 1 minute. And that may sound like a long time, but just about, I mean, a huge quantity of disinfectants are not effective unless they're on there for 10 minutes. And it's pretty difficult to keep something wet for 10 minutes. There's a fair quantity that are 5 minute, and there's even some that are 30-second, which we eventually found and got to. But the Rejuvenate disinfecting wipe, it's hydrogen peroxide based, so it requires no PPE. You don't have to wear gloves or glasses if it's used as directed. So on this cheat sheet that I made of the different disinfectants we were using for different purposes, we wanted to go through the uses, the PPE required, and the dwell time. Many of these products, we even wrote the dwell time right on the product, so people know how long it has to be on the surface to properly disinfect it.
Curt?
Yes?
So I'm curious about a dwell time for something like a Clorox wipe you would find at the store. What would that be?
I remember in the beginning, Clorox wipes were 5 minutes actually. I did look at the end list recently, which is constantly updated, and I believe Clorox wipes are down below 5 minutes, but every product is listed on that site. I think there's 131 products on the EPA N list that are certified to kill, it's not certified, that are believed to be able to kill COVID-19. And actually, the way you would look them up on there, the best way, on every one of these disinfectants is an EPA registration number. And it's usually a 4-digit number with a dash followed by a 2-digit number. And the 4-digit number is the manufacturer. The 2-digit number is the product line. And then in some cases, there's another number after that, which can confuse people. And that's in a case where one company might buy the product from the manufacturer and put their own name and label on it. So that last number can almost be disregarded. If you're looking stuff up on the N list website, you go by the first 4, the first group, followed by the next 2 or 3. And that'll tell you exactly what product it is. You can actually, the instructions have to be identical. So even if a new company puts their label on someone else's product, the instructions will be identical, even though the front label might be different.
So how many of these did you have at all of your branch locations?
How many different products, or?
Yeah, how many different products?
Quantity?
Well, both.
Well, to begin with, everything was very hard to get. So we were just bringing stuff out almost as needed until we could meet the inventory that we put forth for ourselves to meet. Right now, we just have a dozen canisters of wipes. A gallon of that Rejuvenate concentrate actually makes 64 gallons. So I'm sorry. The concentrates, really 1 gallon at a location will last you for a really long time. And it might seem kind of scary that 1 gallon would cost you $50. But when you think that it makes 64 gallons, that's not so bad.
So what made you decide to use this brand, this Rejuvenate brand?
Well, the wipes at the time had one of the lowest dwell times. And that's kind of the biggest challenge when disinfecting, is trying to keep something wet. And I think a year ago, they would just wipe something down and walk away, and it was fine. But the concentrate, that's kind of for a concentrate like that. And again, the Rejuvenate one-step disinfectant, the spray, the concentrate, is also made with hydrogen peroxide. So no PPE is required if used as directed.
Okay, thank you.
Yep. And we use that for disinfecting our computer stations. It seemed to be the best solution. We had to come up with a procedure of how to clean each computer station or disinfect each computer station after each patron used it. That seemed to be the best product. The wipes were more difficult to get. although they were fastest. And this product, we could have a spray bottle and just paper towels. And at the time, a lot of stuff was hard to get, as we know, paper towels, toilet paper, everything. So, we had to get creative to begin with. And actually, so when I have all of these products at each location, I didn't really want to tell people exactly what to use for every single thing, and that's the way it is. So I went to each location with this cheat sheet and showed everyone what each of the products did, and just told them, you can use whatever tool you think is right for the situation. Sometimes you might need a 30-second disinfectant if there's not really time to keep something wet, or there's people coming in back and forth. So I just described how to use all of them and leave it up to the individual as how they would want to use them. Although I do have recommended uses on this sheet. The ones with the longer dwell time and even less expensive, they're pretty good for mopping floors, or at one point we were saturating microfiber towels with the liquid to wipe down high touch points when we didn't have other materials available. So the first two Rejuvenate products were hydrogen peroxide based, which are relatively safe compared to quats. Most other disinfectants are quats, which is 4 types of ammonium. Clorox wipes are quats. The Simple Green and Neutral Germicidal Cleaner are both quats. And also one of the fastest ones that we've ever got a hold of was the Decide Ultra Disinfecting Spray. And that's a quat with alcohol as well. But it works very quickly. It doesn't leave any residue, but you do have to wear eyewear and nitrile gloves when using it. Mainly just the maintenance staff would use that for disinfecting all high touch points in the building. But I told other library staff about it as well. If they needed it, that was there for them to use if they use it properly. And then we created disinfection schedules. At one point, the CDC was recommending every 2 hours in certain buildings. So we had to look at when we were open to the public and when we weren't, when staff was getting there and when they weren't, and made schedules for disinfecting certain areas and areas for staff to initial, so that we weren't losing track of who was doing what. So then we can start to talk about measures taken to prevent transmission. I think these are all the obvious ones that all of us have been doing. Obviously, stay at home when you're sick. We promoted self-monitoring. We weren't taking people's temperature at the door. We were training them and talking to them and asking people, please keep track of your own physical condition and how you feel every day. On your way to work, how do I feel? Am I warm? I mean, I think I felt my forehead 1,000 times over the last year. Maybe not that many, but some days you just feel kind of warm and feel your forehead, seems warm, take your temperature and everything's fine. So we promoted self-monitoring. But really physical distancing and masks seem like the cheapest, easiest solution to this whole thing, in my mind. It barely costs anything, and it's just a choice. If you just choose to do it, then it's done, and that would almost prevent everything. I don't know, seems like that to me. We also provided gloves, face masks, face shields, floor decals, that's an easy one. Plexiglass, I think I bought 53 of plexiglass stand-ups, kind of like the one you see on the screen there. They're somewhat expensive, I think we were paying $100 a piece. And to begin with, you couldn't get those either. You definitely couldn't buy sheets of plexiglass, which is where we started from the different plastic manufacturers. But one of the things I kind of learned early on, even if they said they weren't going to have them for a month or two, I placed the order anyway. For the sheets of plexiglass and some of these devices, and I think I still, I just received some stand-up hand sanitizer stations 6 months after I ordered them, but we needed them. So I think it's a good idea to just get in line. If you're looking for a product and you can't find it, just place an order and then keep looking. And that happened to be many times where 3-4 months later, the stuff finally shows up and it was perfect because we needed it. Something you may not know about are, they call these hinges, this little plastic H-shaped thing, and that clips onto the edge of the plexiglass so you can connect it to another plexiglass. So that eliminates the tiny gap between, and it also provides some structure so that they stand up a lot better when they're hooked together. We have a few service desks, actually most of our service desks have multiple pieces of plexiglass that are connected with these hinges. And then the retractable belts, we use those in certain locations. Probably know some patrons like to kind of leak around the edge of the service desk and come and stand next to you and look at your screen with you. Or some staff areas may not have doors where it's just an open space where someone could walk in, so we put those there. We had other areas where we may have a row of bathrooms down a hallway, and we had separated, the first two from the last one. The first two would be the public restrooms, and we just made a staff restroom at the end. So this particular retractable belt is magnetic. So you just screw a tiny little piece of metal onto one side of the wall, and you screw this device on the other side of the wall, and then you can just pull it off and click it on as needed. Many others come with stanchions that they stand up with. We didn't purchase any of those. One of the bigger tasks, and you could say inexpensive if you have staff time, was to reorganize staff spaces. There's plenty of situations where we had people, they were already sitting way too close for 6-foot distancing. I think there was one room, maybe just 150 square feet, and this is a couple of years ago. I think we had 4 staff members and 4 desks in this tiny little room. So that's kind of the opposite. So one thing we did, we used up all the spaces we could to spread staff out. Our administration moved to the 3rd floor of Central, and we cleared that area out for our adult services and customer service staff. The youth services department also moved to a larger meeting room for their staff areas. We got dividers, kind of cubicle sections that we could put between them, and laid them all out 6 feet apart as well, or more. And this might look like a messy nightmare, but we used our meeting rooms as we had to. We moved staff office spaces into the meeting rooms. And as we were removing furniture, we didn't want furniture out in the public when they were coming into the building, because they would obviously sit there and then you'd have to tell them to move. We're not allowing hanging out. It was basically intentional browsing. So if you're not browsing, then you can go. But study rooms were very useful for spreading out staff, getting them out of their small workspaces, creating workstations, and storing furniture, as well as study rooms. And the study rooms actually worked really well for virtual meetings as well, because we only have so many staff stations. We were able to take laptops, bring them into the study room, and then they could participate in the virtual meetings. So as I said a moment ago, removing and reorganizing furniture was a big step we had to take before Chapter 3 and when we let intentional browsing start happening. So we had to take out so much furniture, and actually at the Central Library, where we had so many large tables, there is really nowhere to store them. So we kind of set them on their side and ratchet strap them together and cover them with some tablecloths so they don't look completely awful. But we have these huge wide open spaces now. But storing that furniture is definitely a challenge. I believe at the East Branch, we completely filled their meeting room with furniture, and they still needed some staff areas to spread out in so to be socially distant. So we actually kind of configured the piles of furniture in that meeting room to create a barrier. So in this very small meeting room, we have 2 work areas. I'm currently working on getting some of that stuff stored at a different location. CAD was actually very helpful. If you have any of your building plans on CAD, I found it very helpful to plan out computer stations of how close people could be when we open computers. And then actually with reorganizing staff spaces as well. I didn't really go with the 6-foot circle around someone because it's not like 6 feet from the center of your body to the center of theirs. You want 6 feet between you. So really I was going with 7 feet. So there's a 1-foot circle in there, which is basically where the person would be. And then 6 feet from that is the other circle. So setting up meeting spaces ahead of time, I thought was pretty critical. Right away, our auditorium was still being used by different groups. We had staff meetings in there, even when we were close to the public. The Brown County Board of Supervisors have been having subcommittee meetings in there. So again, on CAD, I laid the whole thing was already laid out, so I could basically place circles around each seat that I suspected we could use, and we could kind of calculate the most we could get in there while maintaining social distance. So in the auditorium of 300, I have about 25 seats throughout the seating area. I have 5 places on stage where supervisors can conduct their subcommittee meetings, and then a couple of socially distant tables for the presenters at those meetings. Also, the meeting rooms, the way I set up the meeting rooms for staff spaces, the library board meetings, and then now that we're open to the public, we'll leave these set up like this all the time. This is be our standard setup. But our meeting room now holds 12 people. We decided to set them up so that everyone is socially distant. Obviously, people can push stuff around once they're in there. But we can fit 12 into this meeting room. So our meeting rooms right now are 12 each. Our study rooms capacity, we're at 2 each. And we recommend they're from the same unit. So close contact, limiting people in the building. Obviously, we're gonna either, depending on your policy, either let people in the building or not. If you do, we are posting occupancy signs that let them know how many are allowed, so that it's possible they may not be let in. Volunteers, we had suspended for most of the time. We let the Friends book sorters come in a little bit earlier, and now we're evaluating volunteers on a case-by-case basis. We didn't do too much work from home. But that's something to consider if we're trying to limit the amount of people in the building. Our delivery service between our branches, we had suspended for the first couple of chapters, and the maintenance staff took over that delivery. So we have a maintenance van, and twice a week, I believe Tuesdays and Fridays, we would go between all the branches, oftentimes twice in one day, because you're picking up and dropping off at everyone. So you pick up some stuff at the first branch that might have to go back to, actually you pick up stuff at the last branch that might have to go back to the first branch that you stopped at. We did reinstate Walco delivery fairly recently. I'm not sure exactly when, but now the delivery service is back. Contractors, we had to make sure that all contractors knew that they had to wear face masks, and They couldn't have symptoms, and they had to go through the checklist before they were allowed in the building. With our computers, we needed strategies for staff to be able to help people on computers without getting close to them. It used to be you're leaning over their shoulder and typing on their keyboard and touching their mouse and being way too close. So one strategy we got from our IT department was BOMGAR, which is a remote support program. So from the staff station, you could remote in to the patron's computer and then help them with their own computer. We also got wireless mouse and keyboards for all staff. So if someone needed help and you needed to be closer to them and not back at the service desk, you could just plug in the dongle and then you could remotely help them from 6 feet behind them. We also got laser pointers for everybody. They work on some screens and not others, but you could at least point to stuff on their keyboard or anything else if you needed to. And then for a computer cleaning protocol, we went with Glad Press and Seal to wrap the keyboards in. It didn't seem like a great way to clean keyboards without liquid getting down between the keys, aside from using the wipes. And at the time, it was hard to come by wipes. It was hard to come by everything. But we could get that Rejuvenate concentrate, which had a 5-minute dwell. So procedures were written up for cleaning each computer station after a patron had left. And the Glad Press and Seal was pretty helpful. We may have used it on some copiers and some other stuff, but I believe on some of them it had left some residue which had to be cleaned off, and that wasn't working well. So high touch surfaces, again, this is all basics. I think everyone knows hand sanitizer, wash your hands, wear gloves, disinfect, and don't touch your face. And actually, lately, the past couple of documents that have come out in early April, as far as I've seen so far, are starting to lean towards less frequent disinfection, and that disinfection is less likely to be the source of transmission versus aerosols. But I'm not quite ready to completely jump on that bandwagon. I'd like to take it slow. I mean, if hospitals are still doing all these things, then I think we can do some of them. And it's just good hygiene. So we'll have to wait and see where that goes. Other high touch surface strategies we have are propping doors open. So that people don't have to touch them as they go in and out. And actually, it's rather convenient. If it's a door you go in and out 10 times a day, it's pretty nice to not have to open it. One thing you do have to be careful, though, you should not prop open fire doors or check with your local authorities. But a fire door on the spine of the door will be rated and will have this metal tag riveted, usually, into the door. So if when you open the door and you look at the little edge where the hinges connect, you shouldn't prop open a door that is fire rated and has this fire tag unless you've been told that you can by someone that's not me. We also had these cotton swabs we could get for less than ½ cent each. So you could buy thousands of them and keep them out in your touch screens. So if people aren't comfortable touching the touch screens on our pay stations or our copy machines or self-checks, they could use these little cotton swabs and then just throw them away. We did have drinking fountains completely closed to the public until 4 days ago when we opened bottle filling stations only. It seemed like there was very little possibility for touch because they're motion sensed. We didn't want to do the drinking fountain because that's where you could have contact with the spout, and that wouldn't be good. But you should be aware that if you do close a drinking fountain for more than, I believe, just a few weeks, there's a reopening procedure. Some of the procedures are very extensive, others not so much. But at a minimum, the filter needs to be changed if they have one, and the lines need to be bled out completely. The chlorine that's in our drinking water only lasts a certain amount of time. So if nobody uses that drinking fountain for a week, the chlorine's no longer in there. And it's possible Legionella could develop in there. Heavy metals leach into the water. So that first water that comes out of there is not treated with chlorine and may have some materials leached into it. So I had staff bleed them once a day for a few weeks. Then we changed the filters and bled them some more. But there's plenty of procedures on restarting water systems that have been out of service. Obviously, I think we all know quarantining books, and I think staff around here is pretty happy that we're over that part. Our drive-up window at the Central Library, we opened for the first time in decades. We got direction to do it as quickly as we could way back in, I believe that it was April. And I think we had it, we had to cut some holes and do some stuff. This is not our drive-up window in the picture, but we had that done maybe within a week. I think we might have got it going. But that was a huge benefit. We were so glad to have that drive-up window in place. And it wasn't too hard to get going. Our window didn't move, so we had to have a drawer that would push through. But I almost think that that's better in this situation. Although you did have to have a microphone then. Other measures, touchless everything, pretty much. These bathroom faucets, we were able to get for around $100 a piece. Still very high quality. They weren't Sloan or Zern, which would be 4 or 5 times as much. But we were able to get them pretty easily, and it only takes a technician maybe 15 to 30 minutes to put one in. We also did touchless kitchen sinks, which are pretty neat. You just wave your hand. The ones we have, you wave your hand by the side. They start flowing and keep flowing until you wave your hand past the side again. They're not the type where you, as you hold your hands under, they come on. So you kind of turn them on and off with the wave of your hand. This funny looking little thing is an adapter that we got for our very old sinks at the Central Library where the faucet mounts vertically. So it wouldn't fit this horizontal area like the other 2 sinks would. So this actually just screws on to the spigot at the end. It is a little bit chintzy, and I wouldn't say I would get one at any other time, but when we were trying to find solutions for bathroom sinks without replacing the entire sink and everything that was there, this was a nice, inexpensive alternative. I think they were only $30 or so. And then the automatic flush valves for our toilets. These do cost about $140, but they only take a maintenance person probably less than 5 minutes to put in. You turn off the water supply with a screwdriver right there at the fixture, unscrew this bolt and screw the next one on, turn it back on, and you're on to the next one. So that's a very easy task. We did add quite a few of these paper towel dispensers where you're just pulling out the bottom. The automatic ones were expensive, and in my opinion, when I run into them, you're waving your hand all over, you're putting it above and below, and it just seems like a hassle. And in my opinion, these are touchless because the paper towel is always sticking out of the bottom. You can just grab one and pull a couple out, and you're not touching anything but the paper towel. Some people also like to use them to open doors or to operate elevator buttons or stuff like that. So we did add some different paper towel dispensers in other locations around the library for people to use. Other measures we took, we installed these flex book drops, and these have an RFID pad right in them. They're kind of brand new. They are expensive, but luckily, Linda, our finance manager, was able to find a grant to pay for them. So we are very lucky to have that. So we did get one of these for almost every location. They're extensive to install. It takes concrete cutting and wiring and data connections and all sorts of stuff, but we did most of it in-house with our maintenance staff. We did sub out for the concrete cutting. This is a really cool concrete saw if you're into that kind of thing. But the big advantage of those was when items are quarantined for 4 days, we're not touching them. And the public keeps calling, asking why their materials are not checked in yet. So with these, the initial benefit is that everything is checked in immediately. Even if they're put in stacks, these new devices can read the RFID tags all the way through the stack of books. And then going forward, there'll still be many other benefits once we're out of this pandemic that we're in. Another measure is increasing your outside air. So increased ventilation in your buildings. If you don't have access to your HVAC system, it's something that a contractor can do pretty easily. Depending on if it's the middle of winter or the middle of summer, this may be expensive or this may be very inexpensive. But air quality standards are changing, especially over the last year. And the more outside air, the better. It's just that if it's 10 below, we have to heat that air up to compensate for that temperature change. And then same with the summer. The harder part in the summer is humidity rather than heat. But increased outside air, I think we could see some changes coming as far as the code goes, in my opinion. Other measures we took is we had a greeter position. So inside of each of the libraries, once we started letting the public come in for intentional browsing, we had a person stationed in that entry area, kind of different for each library, but they would have masks and hand sanitizer and wipes, and they'd be prepared. They had a counter, so they could click if someone comes in or goes out. They could keep track of occupancy that way. Make sure people know what's going on and help direct them to where they're going so they're not wandering around as much. And it's kind of a all-around helping position. No food and drink in the library because obviously people have to take their masks off to do that. I believe in Chapter 4, we are allowing people to drink as summer months are coming up. And with the open bottle filling stations at the drinking fountains, that would make sense when it starts to get hot. Signage everywhere. There's a lot of signs, but Sue Lagerman did an incredible job with our signage. I swear, making new signs and keeping up with all the changes, the signage is almost a full-time job. But she has these awesome signs here. Contactless pickup sign. And then I think I talked about before about ordering materials. That was a whole new ballgame, ordering materials if you couldn't find something, or if the date that it would be delivered was totally out of line. Many times I just ordered it anyways, and it was kind of a nice little surprise when it finally showed up that I didn't have to find something else or was without something. And then like through this entire process, almost the most important thing probably is just the planning and the training and the communication. We had weekly all staff meetings, and right now we have 2 a week because not all staff can get to everyone at every time, as we have to keep the libraries open. So there's 2 at different times of the day. They're all on Teams, so we just need to get to a computer or a device. But it's a great way of just sharing information. Where are we at now? Through this whole process, things were changing so quickly, sometimes daily. You know, weekly meetings almost weren't enough. And getting feedback from all staff is important. I think we sent out surveys after each chapter change to see how people are feeling, get ideas. But the good ideas come from all of us. And, you know, we all did this as a team, and all of Brown County Library, every employee, just thank you. You know, that was awesome. But the planning, the training, I think is one of the, that makes all this other stuff happen and happen smoothly. What I don't really know about, or no one knows, is going forward. Oops. What is everything going to look like next? We can all guess, but who knows? In my mind, I would like to see, I would like to think that once we get through this and most of us are vaccinated, that things will just go back to normal almost. In my mind, if we don't see a pandemic traveling across the other side of the world and then entering our country and then getting to our state and then getting to our county, I mean, that was a long lead up before it actually got to our doorstep. So I think there's plenty of time to put these measures back in place if, you know, if we're comfortable enough to take them down, if the risks are low enough. So I'd like to think that we could just go back almost to the way it was. And then if we do see something coming and the warnings coming and traveling across the world and then into the country and into our state, we could start to preemptively take these measures because we've been through this nightmare once before. I don't plan on getting rid of the plexiglass. That was very difficult to get a hold of. And, you know, maybe staff will be more comfortable with a piece or two on their desk, on the service desk. Right now, you know, we have up to 8 or 9 pieces on some of the bigger, longer desks. I don't see that as being necessary, I hope, if everything goes good. But I can see the light. So personally, I got my vaccine at Lambeau. I think my next one's coming up in just a week or two, but I don't know if anyone knew that at Lambeau, you can actually get 2 shots in one day. Oops. Oh. So anyways, that was the first time I went to a bar. I was there for about 4 minutes and it cost me $14. But anyways, that's what I have for now. Does anyone have any questions?
I'm laughing at the photo. Thank you, Curt. If any of you have questions, feel free to put those in the question box. If we do run out of time, Curt can stay a few minutes later, so we can take questions even past the time if we need to. I have to tell you, Curt, I had a message sent to me during the presentation that said, "Curt is, as always, amazing. I had no reason to take this webinar except I'm a Curt fan." I thought that was nice.